Thank you for tuning in to the Brach Eichler Talks podcast, where we explore and discuss today's trending legal topics. In this episode, we discuss a recent healthcare law alert from Brach Eichler titled "Deadline Fast Approaching for Medical Practices to Have Accessible Diagnostic Equipment. Is Your Practice Ready?" On July 8, 2024, the Department of Health and Human Services, HHS, implemented new accessibility requirements for medical diagnostic equipment, MDE, used by all public and private entities receiving HHS funding, including Medicare and Medicaid participants. These requirements apply to doctors, dentists, hospitals, clinics, emergency rooms, and other healthcare providers that receive HHS funding and use MDE to provide healthcare services. MDE includes, but is not limited to, examination tables, examination chairs for eye or dental exams and procedures, weight scales, mammography equipment, X-ray machines, and other radiological equipment commonly used for diagnostic purposes by health professionals. Highlights of the new requirements. 1. Effective July 8, 2026, all HHS-funded entities that use exam tables and weight scales must have at least one accessible examination table and one accessible weight scale that conform to the U.S. Access Board standards for accessible MDE. 2. If an HHS-funded entity purchases, acquires, or leases MDE after July 8, 2024, the MDE must meet applicable accessibility standards until the entity satisfies the required threshold for its equipment inventory. 2A. For most healthcare settings that utilize MDE, including physician offices, hospitals, and outpatient entities, the threshold is at least 10% of each type of MDE in use in the facility, but no fewer than one unit must meet the accessibility standards. 2B. For entities specializing in the treatment of conditions affecting mobility, such as rehabilitation centers and physical therapy entities, the threshold is at least 20% of each type of MDE in use in the facility, but no fewer than one unit must meet the accessibility standards. 3. Entities must ensure they have staff trained to operate the accessible MDE. 4. Entities must ensure they have staff trained to assist patients with disabilities in transferring to the accessible equipment and positioning them on the equipment. We can help. To ensure full compliance with the new accessibility requirements, contact us to address any questions you may have. John D. Fanberg, Esquire, Managing Member and Chair, Healthcare Law at jfanberg@bracheichler.com, or 973-403-3107, or Edward Hiltzenrath, Esquire, Member, Healthcare Law at ehiltzenrath@bracheichler.com, or 973-403-3114, or Vanessa Coleman, Esquire, Associate, Healthcare Law at vcoleman@bracheichler.com, or 973-364-5208. Don't forget to subscribe to our podcast on Spotify, Apple Podcasts, and YouTube. Follow us on LinkedIn and Facebook for updates on new episodes. For more information and resources, visit bracheichler.com. This is intended to provide general information, not legal advice. Please contact the authors if you need specific legal advice. Brach Eichler LLC is a full-service law firm based in Roseland, New Jersey, with over 80 attorneys. The firm is focused on the following practice areas: healthcare law, real estate, litigation, trusts and estates, business transactions and financial services, personal injury, criminal defense and government investigations, labor and employment, environmental and land use, family law services, patent, intellectual property, and information technology, real estate tax appeals, tax and cannabis law.